Hi, this is your Houston Chiropractor, Dr. Gregory Johnson. We've got Blessed in here with us this morning, and Blessed has been watching us on YouTube for how many years now?
Almost 4 years now.
4 years, yeah. That makes you a crack addict, you know?
Yes, I know.
And he comes in complaining of low back pain that radiates down into his right buttocks and down through his thigh, all the way down to his front of his leg here, and down in the lateral aspect, the top of his right foot. He does have some numbness and tingling down there. That's called paresthesia. Thoracic spine tightness, especially in this lower thoracic region, mid-thoracic. Left rib cage pain that goes around off of those subluxated thoracic spine vertebrae. And he's had chronic neck pain and stiffness for several years now. You said 2019, I think you told me.
The neck has been 2 years now.
Oh, 2 years ago on the neck, because that still makes it chronic, yeah. No headaches or dizziness or nausea or any of the spontaneous cervical artery dissection issues that we run through on the history. And you've been to a lot of chiropractors and doctors before.
Correct.
And you already had back surgery for this before, laminectomy at L4.
Correct.
And that didn't really do much for your radicular pain down your right leg, did it?
No.
And that's why you're here today, because you've already saw other chiropractors.
I figured let me just get a ring dinger.
Yeah, there you go. Ring dinger to the rescue, just like always.
That's right.
So let's show them your posture first, Blessed. I'm gonna have you close your eyes again and bend your head forward and backwards for me again. And then back to neutral, please. You can see his head's forward and translated over to the right. See how it's also tilted to the right? It's also rotated to the right. So that's a negative SX cervical, positive SZ cervical, negative theta Y cervical, and he also has a positive theta Z cervical rotation up in his cervical spine, which is why his head's tilted off to the right. Now down in the lower back, he's got more room on this left side than he does over here on this right side, so his pelvis has translated to the right on the x-axis as well, which makes him subluxated, which is that's why we see the subluxations when we evaluate a patient's posture. In fact, our patients know when to come see us for an adjustment just by looking in the mirror at their posture. Let's have you go face down for me. So his left leg is about 1/4 of an inch shorter than his right leg. I bring him up, it gets even, and that does tighten up down his low back and thighs. So that's a positive Deerfield on the left and a positive Nautilus lumbosacral hypertonicity. He does have a left sacral deviation, so I'm going to start adjusting his left sacrum first. Superior, inferior, center sacrum, right sacrum, right SI, left SI. And you're going to probably go feel these the most, Blessed. That's L5, straight P to A, L4 P to A, L3 P to A with the I-S drive, L2 P to A with the I-S drive, L1 P to A with the I-S drive. There you go. I'm going to have to bust some of this concrete up on the ring dinger. All right, let's recheck your leg length here now. Perfectly even. Tell me if this feels easier yet.
Yes, it does.
Imagine that. You'll feel your head popping up next. This is great when you can see predictable results. Very good. Okay, let's turn you on your back, please, sir. So far, so good, huh? A little deeper in person, though, huh?
Oh, yeah.
Okay. I'm going to bring your whole head up and over your spine where it's supposed to be. Yep, now slide down about an inch. That's good. Put both arms out like this. I'm going to adjust your shoulders, your clavicles, and your anterior ribs. There we go. You can relax your hands right there on your tummy now. Let this right leg go like a limp rag. There we go. You should have felt that from your knee all the way up to your lower back.
Yes.
Very good. All righty. Let's have you sit up, face that way, please. There we go. Okay. There we go. Your right little humeral joint. Left little humeral joint. Same thing you watched on the videos, isn't it?
Yep. Totally different in person though.
Yeah. Yeah. It doesn't do justice watching videos.
No, it does not. You need to come and do this.
Yeah. Agreed. And don't be trying this on your buddy at home either.
No.
We discourage anybody that's not licensed and trained to not do these procedures. Okay, let's come over here on this table on your back.
Okay.
Butt there, head up this way, bless. Now I'm going to decompress your entire spine with this one move.
Okay.
And call it the ring dinger. Because I ring the bell every time. You instinctively knew this is what you needed, didn't you?
Yeah. Everything else wasn't working.
Yeah.
And I was like, that's it. I'm not going to wait any longer.
Good for you. You know, that's a lot of people sitting home watching this. That's exactly how they feel. But they don't take the actual step and get here.
4 years watching this, and now I'm like, you know what? It's time.
Yeah. Most people say, I wish I'd done that years ago. Lift your head up for me. And lay it back. Okay, take a nice deep breath through your nose. Keep your teeth together so you don't bite your tongue.
Oh, Jesus.
Yep. Deep breath in through your nose, out through your mouth, Wes. In through your nose, out through your mouth. Yeah, looky there, you're kicking even better. See how that improved your reflexes?
Uh-huh.
It's not pathological reflex either, like some idiot ortho surgeon up there said.
Wow.
That's a wild adjustment, isn't it?
That is a... I don't even have words.
There you go. Just like that. Doesn't get any better than that. Good first
I
adjustment.
will literally say to anybody that is watching this at home and you've been wanting to do this, you need to come and do this.
Let me help you up. There we go. Yeah. You should feel lighter already.
It's completely different.
Yeah. Wow. I'm still gonna shoot you.
Okay. I got it.
All right. There's probably still gonna be some sore spots in these paraspinal muscles at this point. But we're gonna help relax these guys for you as well. Now I'm gonna show you your homework that will help you to help yourself.
Okay.
Because of your job and everything you're doing forward, it pulls your head forward and your shoulders forward. So shoulders up and back.
Okay.
Shrug them all the way up to your ear. And then back simultaneously. See how it tightens up that trap?
Yep.
Your forward Z. So we go negative Z. Then look back at the wall, negative theta X cervical. We'll adjust your atlas while you're in a mirror image to relax. Do this again, see if this feels any smoother yet.
Yes.
Imagine that. Take a look in the mirror.
Wow.
Look where your shoulders are squared off
Yeah,
now.
they're actually even. Everything's straight.
Yeah.
My head's straight.
Yep.
Oh, this is awesome.
So how would you describe the experience of coming here to Advanced Chiropractic Relief versus all the other providers that you've seen for this?
100%. I should have done this a long time ago.
Yeah.
Definitely.
It's all right, you're here now though.
When you said it was going to be a 9-day difference, you'll know.
Yeah.
I know.
Yeah, you definitely know right
Oh
away.
yeah, immediately.
This is not something you have to wait and guess on.
No, no.
I wonder if that's helping or not. You're going to know pretty quickly.
My leg feels better.
You imagine
She
that.
stands straight.
Yeah. It's pretty cool stuff.
I appreciate you.
Oh, it's my pleasure.
Thank you.
Well, since you got your first ring dinger today, I'd love to tell about it. If you felt that ring dinger all the way down, ring our bell.
Bye. Pleasure.
Ooh, baby. See, that's a real deal too.
Yeah.
Well, this is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with blessing from Missouri City, Texas. We'll see y'all soon.
Thank you.